For our hands-on session that we're going to do in a little bit, we're going to give you a surgical kit, and this is the Cybron Implant Solutions surgical kit. And we've already discussed some of the burrs that are in this kit. First and foremost, we have the lindamen, and if you remember, this is a very sharp burr that is also edge cutting, and this is the first burr that we're going to use. We'll then move, we're going to go in 1 millimeter increments and kind of go through the tissue and only put it about maybe 3 millimeters into the bone, just enough so that the burr is retained in the osteotomy site. We'll then go to a 2.2 diameter twist drill, and we'll go to length, and the length is going to be determined radiographically either with our DEXIS radiograph or with our CT scan. We'll then move up the ladder and use a 2.8 twist drill, which is the drill used for the 3.3 diameter implant. Remember, with the Cybron system, the osteotomies are undersized, meaning that the implant itself is self-threading and will actually tap into the bone or cut into the bone, so you have very good retention. If you're putting a larger implant in, for instance a 4.1 diameter, we'll then go to a 3.5 diameter twist drill. And if we decide to go to a 4.8 diameter implant, we'll use a 4.2 diameter twist drill. So what you're going to have, or you may have, and it may be different in different courses, but we're going to check our box, and this implant is a 4.8 by 4.1 by 11 implant. These are our dummy implants that we'll be using in the hands-on portion. So we're going to, because the body of the implant is 4.1, we'll go all the way up to the 3.5 diameter twist drill, but then we're going to have to profile the crestal region of the bone, and I'll explain that in just a few moments. But let's begin by, we'll set our handpiece, and we talked about that earlier. We're going to set it at 1,000 RPMs. It'll be at 55 Newton centimeters of torque. And because we're not using water here, we're cutting on dry models, we will have zero water, and we'll demonstrate that to you on the handpiece. So we simply have our motor handpiece. We're going to take the lindamen drill first, and it's simply a latch. We'll lock it into place, make sure it's tight, and let's do the number 5 implant area. And first palpate the ridge, and you can see that we have a pretty good ridge here. We want to basically be center across the occlusal tables in this situation. So we're looking at it buccolingually, but also occlusally to make sure that we're not breaking the buccal plate. And we're simply going to drill, pumping, 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 till maybe 3 millimeters into bone. Now on your patient, you will then take this burr and place it in and take a radiograph. And it looks like we're pretty parallel there and in pretty good position. Now, we can also take a perioprobe and measure the thickness of the gum tissue, and the thickness here is about 3 millimeters. If you remember, we said we're putting 11 millimeter implant in place, so 11 millimeters into bone plus 3 millimeters of tissue is 14. So we're going to take our burr and we're going to go to depth here to 14 millimeters. If you remember, Belinda, if you can bring it a little closer, if you can fade into the burr. A little bit more, please. There you go. And you can see here, come down just a little bit, there you go. The markings are, the first heavy black line is 7, then 9, the second heavy black line is 11, then 13, and the top black line is 15. So we want to go to about 14 millimeters, so between the top of the second heavy black line and the 15 millimeter marker line. And I'll come to you, Belinda, that's okay. There you go, perfect. And again, we're going to make sure that we're in good position, nice and parallel, and pump up and down about 1 millimeter at a time. to about 14 millimeters. Again, at this juncture on a real patient, we'll replace our pin and we'll stop and we'll take a radiograph. Now the next thing that we can do is we can punch the tissue, and we'll have a little tissue punch ready for you. And there's not one in my kit, but we'll use this little tissue punch and we'll just simply punch the tissue firmly going into tissue. And we will be able to cleanly remove the tissue over the implant. Now you can stop with the perio probe again and measure the thickness of the tissue. And you can see the little tissue is in the tissue punch. So let's move forward, and as we said, we're putting 11 millimeter diameter implant by 4.1 with the crest of this implant at 4.8. So again, we're going to go to proper depth, millimeter at a time, to about 14 millimeters, assuming that our tissue thickness is about 3 millimeters. And you can see we have a nice osteotomy site forming. We'll then go to our 3.5 diameter twist drill, which is acceptable for a 4.1 diameter implant, and same difference, millimeter at a time until we get to proper depth. We've now prepared our osteotomy, and again, each and every time you use a different burr, we can simply place it in our osteotomy site and take a radiograph. Make sure that we're in the correct position, the correct length that we want. Now, because we're doing a wider diameter crestal portion of the implant, we're going to have to profile or bowl the crestal region up a little bit, and we're going to use this burr called a profiler, and it's just a little bit wider. It's just cutting at the crestal portion of the bone, and that'll just increase our width at the crest to accept a 4.8 diameter implant. So we're basically done drilling. And what we'll do is we're now going to place the implant into the osteotomy site. First thing that we're going to do is we're going to switch over our handpiece, our motor, to 35 RPMs, which is very slow, and 25 Newton centimeters of torque. The handpiece, the motor, will actually stop when it reaches 25 Newton centimeters. But as we've discussed over and over again, we don't want to place the implant to torque. We want to watch the implant going into the tissue and into the bone. We're going to stop the implant when it's at tissue height, and then we'll hand ratchet the rest. Our packaging is quite clear, 4.1 by 11 with a 4.8 octagon at the crestal portion. The implant is packaged. You'll just break it open and you'll see the implant inside. This is a dummy implant, the brass little thing. But equally important, there will be a healing abutment inside this cap, or a cover screw inside this cap. We've talked earlier about placing cover screws versus healing abutment versus immediately loading. If we get 25 Newton centimeters or less, we will put a cover screw onto our implant. If we have 35 Newton centimeters, then we can predictably place a healing abutment, which will eliminate the need for a secondary surgery. Greater than 35 Newton centimeters, we can use a healing abutment or potentially even immediately load the implant. Now remember, Remember, we turned our motor down to 35 RPMs, 25 Newton centimeters, and we simply place the 4.8 diameter inserting instrument into our handpiece. We'll go to the implant. And they've been used a lot, so be careful, it could fall out. And we're simply going to go to our osteotomy site, and let me just see if I can turn this real slow. You can see how slowly that's turning. We're simply going to go to our osteotomy site, and we're watching it go into the tissue, into the bone, and we're going to stop when it hits the tissue level. Now we're going to go to our hand torque and hand torque the rest of the implant into position. The hand torque wrench is a sophisticated piece of equipment, and you'll have a tool that will simply snap in to the torque wrench. And we have a little arrow, we can see that, is pointing away from me towards this little ball spring here. Now if we wanted to remove the implant, we can simply pull that out and twist it around so that the arrow is going in the opposite direction, and we could actually unthread the implant from the site. We want to torque the implant into position so we have it pointing towards the little ball spring. And the little markings on the ball spring are 15, 25, and 35. So if we're able to torque the implant in at 25, we can put a healing abutment into position. If we only torque it to 15, we may decide to put a cover screw. So let's see if I can do this easily. Do it backwards. You're going to have a fulcrum. You're going to hold the top of the torque wrench, and we're simply ratcheting it into position. And this model is pretty soft here. And if you're not sure, we can always take it apart, stop, take a radiograph, and see at what position the implant's at. Let's see if we can go a little bit deeper in here. So in this situation, because I can only get it to 15, I'd put a cover screw, but you may find in your model that you're able to put a healing abutment in without any issues. So that's simply the placement of the implant. We'll try that and see how that works.